From anatomy to anesthesiology, from pathology to pharmacology, from microbiology to medicine, a one-man resource to the world of health sciences. Welcome to Dr. Paul's Medical Lectures. A practicing physician, Dr. Paul offers you essential insights on diseases afflicting millions of people around the world. For today's lecture, here is Dr. Paul.
Tuning to our channel today. This afternoon I want to talk about Impetigo. Impetigo, a very common superficial infection, and you will see that very often in your clinic. So this is something that needs to be well understood and well treated. Let us start with some basics. Impetigo is a contagious infection. It's also auto-inoculable, and this is an infection of the skin caused by bacteria like staphylococci or streptococci. Impetigo is an infection of the skin, and basically it's a superficial infection. It could be due to group A streptococci or less commonly Staphylococcus aureus. And there are basically two types, a bullous type and a non-bullous type. Those are the two forms of impetigo. And the non-bullous type is like 70%, while the remaining is bullous type. And most commonly it affects young children. But although it can affect even adults, most commonly you see this in kids. Now, what causes this? Mostly a break. You see, in our skin we have this a barrier against infections. When this barrier is weakened, when it becomes fragile due to abrasions or chicken pox or burns, the bacteria, it invades the skin layers deeply and causes impetigo. And many times children living in crowded living conditions, poor hygiene, when they don't clean themselves up well. And also contact sports, when they rub their skin against each other and move that bacteria inside, impetigo happens. The lesions consist of macules and vesicles and bulla. So many times you see vesicles or a bulla, and later they can become pustules and become honey-colored gummy crusts. Remember that, folks. Whenever you see honey-colored crusts, think of impetigo. That's a clue. That's a keyword to identify this condition in medical literature. When you get a question. Now, face, it affects most commonly the face, and there is another form of impetigo called empyema. In eczema, the bacteria, the staphylococcus, they go deep and they cause ulceration and scarring. So eczema is a more serious form of impetigo, and it most commonly occurs on extremities, on hands and legs. Now, impetigo is associated with that classic history, that a mom bringing a child and saying that it started like a vesicle and I could see a pustule, and then a crusty layer formed, and when I removed that crusty layer I could see the pus coming. That's the classic history of impetigo. So whenever you hear that history, a vesicle or a pustule or a bulla forming a crust, then you need to think about impetigo and treat it, because there are many complications associated with impetigo. And many times these lesions, they can grow, but most commonly they stay less than 2 centimeters in diameter. And they can also cause some itching, but most usually they are not painful. So the child may not report any pain. Now, healthy individuals they usually heal well. I mean, if their immunity is good, they heal well and the scarring also will be less. But there are any potential complications. Those complications can be life-threatening, especially in individuals with low immunity levels. The complications of impetigo could be septicemia, the bacteria spreading all over the body, or pneumonia attacking the lungs, or osteomyelitis attacking the bones. And sometimes this infection can attack the kidneys, cause glomerulonephritis. So you see, impetigo has serious complications, folks. And it could kill some patients. Now, how do you diagnose this? Most commonly you hear the classic history, you see the lesion, that's all you need to diagnose this condition. But if you want, you can do culture, you can do gram staining to identify it. So, but in tropical countries, it's mostly Streptococcus, whereas in temperate climates, it's mostly Staphylococcus. There is also another variety, community-associated methicillin-resistant Staph aureus, that is CA MRSA. So community-associated MRSA, when you isolate that from impetigo or eczema, then you should treat it. Now what about the differential diagnosis? I mean, anything that looks like impetigo, most commonly it could be an allergic contact dermatitis. It could be herpes simplex infection. Those are the most important things, and also poison ivy. Now, how do you differentiate it? Contact dermatitis, you see that classic history, and also the linear distribution of lesions. So in allergic contact dermatitis, you see a linear distribution, and the itching will be very, very worse, and the cultures will be negative for staphylococci and streptococci. And also, how do you differentiate impetigo from herpes simplex infection? You see, in herpes simplex infection, you see grouped vesicles. That's the classic keyword for herpes simplex, grouped vesicles. You don't see that in impetigo. And also the viral cultures will be positive in herpes simplex, whereas they are negative in impetigo. The other condition, poison ivy. Poison ivy is a very, very itchy condition. So in poison ivy, and it's very itchy, and also the vesicles will be in a linear pattern. You will see a linear pattern of vesicles in poison ivy dermatitis, like some jelly beans spread in rows on the skin. So if you see that classic picture, that's poison ivy dermatitis. So it's not a difficult thing to differentiate from other skin conditions. Now, before I finish, a few words about treatment. You need to scrub these lesions because, as I said, the crusts are formed, and when you unroof these crusts, you will see the pus just under those thick crusts. So you need to drain that pus before it becomes worse. The best thing to use is a topical antibiotic like bacitracin, mupirocin, and retapomelin. So the bacitracin, mupirocin, retapomelin, these are the most commonly used topical antibiotics. But the point is, mupirocin or retapomelin are more expensive even than systemic antibiotics. That's an important point, because many times we think systemic antibiotic, no, let me use a topical antibiotic, that would be more affordable. It's not. The fact is, these topical antibiotics are more expensive than systemic antibiotics. Mupirocin is more expensive than Keflex. Now, when you see, you can also use systemic antibiotics in cases. You can use Keflex or doxycycline. And if you see CA MRSA, that is community-associated MRSA, in this impetigo, then you need to add more antibiotics, like which have coverage against MRSA. They are doxycycline, clindamycin, and trimethoprim sulfamethoxazole or vancomycin. Those are the antibiotics you use for MRSA. So for those things, you need to use those antibiotics. So remember that, because it's very important disease. And some people, they actually carry Staph aureus in their noses. These nasal carriers, you need to treat them with rifampin, like 600 milligrams daily. So rifampin is the agent for that. And also you can use intranasal mupirocin ointment, like for 5 days. That treats these intranasal carriers of MRSA, mupirocin or rifampin. And how to prevent it? If a child has impetigo and there are other children in the home, all of them should go by bleach baths, because that infection will go around. So you take household bleach and you clean up all the showers and bathrooms, and you instruct the children not to share the towels, because if they share the towels, this bacteria will spread around. So you do bleach baths and also separating the towels. These are the important preventive mechanisms you apply. So remember that, folks, when you treat these patients, you are unroofing it. Yeah.
I got the pictures from Dr. Paul. She's got a proximal tibia fracture.
Oh, okay. Thank you.
You're welcome.
So treat them like, as I said, if you hear that keyword, honey-crusted lesion, think of impetigo. They are children most commonly, Staph aureus or streptococci, mupirocin as treatment, and finally bleach baths as prevention. Simple and that effective. Hope that helps you, folks. Thank you very much, and please visit our website if you have time. Thank you.
Thanks for listening. For more medical videos, please visit us at www.drpaul.org and take time to browse through hundreds of health videos we regularly post on our site. If you are preparing for USMLE, PLAB, and other medical exams, make sure you visit our website to browse through our videos explaining the essential points you need to know before taking these examinations. For more information, visit us at www.drpaul.org. Thank you, and may God richly bless you.